Fenoprofen calcium is a medication used to relieve pain from headaches, dental pain, menstrual cramps, and muscle aches. It can also reduce pain, swelling, and joint stiffness from arthritis. Fenoprofen is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. This helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, it's important to speak with your doctor about non-drug treatments and other medications that may help with your pain. The recommended dosage and timing for taking fenoprofen calcium should be determined by your healthcare provider. Before taking fenoprofen, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 3 or 4 times a day or as needed. It's best to take this medication with a full glass of water, and if you experience stomach upset, try taking it with food, milk, or an antacid. The dosage will depend on your medical condition and how you respond to treatment, so it's important to follow your doctor's instructions. For certain conditions like arthritis, it may take up to 3 weeks of taking this drug regularly until you get the full benefit. Remember, if you are taking this drug as needed, it's best to use it as soon as you feel the first signs of pain. And as always, if your condition lasts or gets worse, make sure to consult with your doctor. If you experience upset stomach, constipation, nausea, drowsiness, dizziness, or blurred vision, be sure to inform your doctor or pharmacist. Remember, the benefits of this medication have been carefully weighed against the potential risks. Many people using this medication do not experience serious side effects. It's important to monitor your blood pressure regularly while taking this medication and report any high results to your doctor. Contact your doctor immediately if you experience severe or persistent headaches, changes in hearing, mental/mood changes, easy bruising, difficulty swallowing, rapid or pounding heartbeat, or symptoms of heart failure such as swelling of the ankles/feet, unusual fatigue, or sudden weight gain. Seek medical help right away if you notice signs of kidney problems, unexplained stiff neck, or symptoms of liver damage such as persistent nausea, loss of appetite, abdominal pain, yellowing of the eyes/skin, or dark urine. While very rare, if you notice symptoms of a serious allergic reaction such as fever, swollen lymph nodes, rash, itching or swelling, severe dizziness, or difficulty breathing, seek medical help immediately. If you experience any other effects not listed here, consult your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA, and if you are in Canada, you can report them to Health Canada. Taking fenoprofen calcium, a nonsteroidal anti-inflammatory drug, may rarely increase the risk of a heart attack or stroke, especially if taken for a long time. This risk is higher in older adults or those with heart disease, high blood pressure, diabetes, or a family history of heart disease. It's important not to take this drug right before or after heart bypass surgery. Additionally, this medication may rarely cause serious, rarely fatal, bleeding from the stomach or intestines, especially in older adults. If you experience stomach/abdominal pain that doesn't go away, black/tarry stools, or vomit that looks like coffee grounds, seek medical help immediately. It's important to talk to your doctor or pharmacist about the benefits and risks of taking fenoprofen calcium. Always follow the prescribed dosage and consult with your healthcare provider regarding the best time to take this medication. Before taking fenoprofen, it's important to tell your doctor or pharmacist if you are allergic to it, aspirin, or other similar medications. This is because the medication may contain inactive ingredients that could potentially cause allergic reactions or other problems. Before using fenoprofen, you should also inform your doctor or pharmacist about your medical history, especially if you have conditions like asthma, bleeding/clotting problems, diabetes, heart disease, high blood pressure, liver disease, or stomach/intestine/esophagus problems. It's important to note that kidney problems can sometimes occur with the use of this medication, especially if you are dehydrated, have heart failure or kidney disease, or take certain medications. Make sure to drink plenty of fluids as directed by your doctor to prevent dehydration and contact your doctor if you experience any unusual changes in your urine. Fenoprofen may also cause dizziness, drowsiness, or blurred vision, and alcohol or marijuana can worsen these effects. It's important to avoid activities that require alertness or clear vision until you can do them safely and to limit alcoholic beverages. This medication may also increase your sensitivity to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Women of childbearing age should talk with their doctor about the benefits and risks of using Fenoprofen, and if you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. This medication may harm an unborn baby and cause problems with normal labor and delivery, so it's not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. Additionally, this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Fenoprofen calcium, it's important to be aware of potential drug interactions that can affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Fenoprofen calcium include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics such as furosemide. These medications can increase the risk of bleeding when taken with Fenoprofen calcium, especially when combined with antiplatelet drugs, blood thinners, or other medications that may cause bleeding. It's also important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Fenoprofen and may increase your risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking the aspirin unless your doctor instructs you otherwise. Additionally, Fenoprofen calcium may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors know that you use this drug to avoid any potential complications. If someone has taken too much Fenoprofen calcium and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, slow or shallow breathing, extreme drowsiness, and loss of consciousness. Always seek help if you or someone you know may have taken too much Fenoprofen calcium. Remember, it's very important not to share this medication with others. Your doctor may require you to have some lab and/or medical tests, such as a complete blood count, liver and kidney function, and blood pressure checks while you are using this medication. It's important to keep all your medical and lab appointments. Your doctor can provide you with more details. In addition to taking this medication, making some lifestyle changes such as weight loss if needed, and doing strengthening/conditioning exercises may help improve your flexibility and joint function. Make sure to consult your doctor for specific instructions tailored to your individual needs. If you are taking Fenoprofen calcium on a regular schedule and you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not take double the dose to make up for the missed one. This medication is used to relieve pain from various conditions such as muscle aches, arthritis, and menstrual cramps. It also reduces swelling and joint stiffness caused by arthritis. The usual recommended dosage for adults is 400 mg every 4 to 6 hours as needed for pain relief. It is best to take Fenoprofen calcium with food or milk to decrease the risk of stomach upset. Remember to follow the instructions of your doctor and take this medication at the same time each day for the best results. When storing Fenoprofen calcium, it's important to keep it in a tightly closed container at room temperature, away from light and moisture. It's also crucial to keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly dispose of it when it has expired or is no longer needed by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.